This is the School Age Essential ETR Module, Part 2. This presentation provides an overview of the requirements for summaries of assessments on the Evaluation Team Report and determining eligibility for special education services under IDEA. Summary of interventions. All previous interventions used, including strategies used in the child care environment, should be included. Please note, the summary of interventions provided is not required for preschool children, but may be included if data is available. This part is very important for initial evaluations and is widely misunderstood. The ETR must contain a summary of the specific interventions provided to the child before moving to the evaluation process. The data from interventions provided in an initial evaluation will be documented on the PRO4. This area in Part 2 must also be included in reevaluations if interventions were implemented. There are separate spaces for the initial evaluation intervention summary and the reevaluation interventions summary on the ETR form. Interventions may continue to be provided once the initial evaluation process has begun, but the ETR may not be delayed in order to complete interventions. The 60-day timeline from the receipt of the written parental consent to the completion of the initial evaluation may not be exceeded due to the desire to complete current interventions. The summary of interventions must include the specific research-based or evidence-based interventions provided, the length of time the interventions were provided, the number of weeks or months during which each intervention protocol was provided. The intensity refers to how often interventions were applied and how many minutes each intervention session lasted. The results of the interventions compared to the baseline at the beginning of the interventions or the pre-test. For instance, on a timed reading fluency test, the student read an average of 33 words per minute at the start of the intervention, compared to an expected grade level performance of 80 words per minute. At the end of the intervention period, 6 weeks, the student was reading an average of 46 words per minute. The decision made as a result of the interventions includes adequate progress or lack of progress based upon all data collected. Then, did the team decide to refer the child for an evaluation or to continue the interventions in some other form, and why the team made that decision? Summary of interventions, re-evaluations. Specially designed instruction, as described in the IEP, does not need to be summarized in this part. However, this summary does need to be completed for all re-evaluations if a child is receiving other specific interventions that are not documented in the IEP. A child who is receiving specially designed instruction, SDI, for an identified area of disability may receive additional interventions in other subject areas where SDI is not indicated, but where the student has needs. These interventions must also be summarized on the reevaluation. Please note, if no interventions were provided, there must be a statement to that effect in this part. Reasons for evaluation. This should be more than a statement that a reevaluation must occur every 3 years by law. It should refer to the need to determine a continued qualification as a child with a disability or to determine if the child qualifies through an initial evaluation based upon referral information. The next area summarizes information provided by the parent. The operating standards state data and information provided by the parent of the child are required to be addressed and may become a component of any initial evaluation or reevaluation upon team agreement. If information provided by the parent is listed on the ETR planning page, the information must appear in Part 1 and be summarized in Part 2 of the ETR. It should list relevant content relating to the student's background, medical history, strengths, and needs for the purpose of the evaluation process. Summaries of observations by teachers and related service providers are required for all initial and reevaluations for all disability categories, as identified on the planning form. The data should quantify the child's performance in terms of frequency, duration, and intensity. The observation should include a summary of the child's academic performance and behavior in the areas of suspected disability, as observed in the child's learning environment, including the general education setting. Each observation conducted must be documented in Part 1 of the ETR by a licensed teacher or related service provider. Preschoolers or children who are out of school for medical or disciplinary reasons should be observed in an environment appropriate for the child of that age and familiar to the child. Observations for initial evaluations and reevaluations cannot be conducted without informed parental consent, a PRO5. Observations may not occur during actual testing or assessment procedures. They must occur in the child's natural learning environment and be current. Current classroom-based observations are considered current if they have been completed within 1 calendar year. Observations must be done in the setting where the behavior or skill in question is most likely to occur or present itself. The observation must be relevant to the suspected disability. Medical information. The focus in this part is on information that is educationally relevant and current. It may be important to reference medical history if it impacts current functioning, for example, traumatic brain injury, or will require related services support, for example, orthopedic support or other devices. If the child has a history of hospitalization or outpatient treatment, this information should be included in the medical information as it potentially affects behavior or learning. Information about the child's medical condition should include concerns or conditions that could affect the child's ability to participate in the general education curriculum and in any other type of school activity, such as recess, lunchtime, emergency drills, or extracurricular activities. Include any medication or over-the-counter substance that may be administered during the school day or at home that may impact educational performance. Any medical procedures that may be required during the school day must be addressed to include a specific description of the procedure requirements, what medication or equipment are required, who is authorized and trained to provide the medical procedure or assistance, when is it to be provided, how often, or under what circumstances, and any other pertinent details related to the student's medical needs. This part would also explain any specific needs for medically related assisted technology. Please note, a medical diagnosis alone is not sufficient to support an eligibility determination. All determinations of eligibility must be based upon multiple assessments and whether the child can access the general education curriculum without special education services. Summary of assessment results. The summary of all assessment results should include a summary of the key findings across all areas assessed or reported. This should not be just a restatement of every assessment or observation result from Part 1. The relationship of the results to the referral and suspected disability, and a description of the child's performance compared to specific and measurable baseline data as appropriate. The summary needs to be stated in a language that is understandable to all team members, including the parent. The summary should describe the child's strengths and areas of concern to develop effective interventions and describe conditions or limitations that impact the validity of the results identified. Description of educational needs. This is a summary of how the child qualifies for special education services and/or related services. The needs in this section will tie directly to the implications for instruction. The description needs to contain enough specific information about the child that will allow accurate supports and services to be identified. This description should include relevant strengths and weaknesses, be clear and concise, include the child's current skills and functional levels, explain how the child may experience difficulty in accessing or making progress in the general education curriculum, be in language that is understandable to all team members, including the parent, provide direction for access to the general education curriculum, and consider the results of the interventions provided to the child prior to the initial evaluations. Please remember, these are suggested educational needs. Be careful not to predetermine services. Implications for instruction and progress monitoring. The implications for instruction and progress monitoring section should be clearly described in this section of the ETR. This must include how progress will be monitored in relation to goals and services. This section provides a summary of proposed supports, services, and specially designed instruction to address the child's educational and functional needs. It is important to describe the instruction or services individualized to the student's needs, not just a standard list of accommodations or modifications. The ETR team must include suggestions or recommendations for progress monitoring and data collecting procedures. For initial evaluations, this group includes: number 1, parent; 2, person qualified to interpret the results of the assessments used; 3, a district representative who is qualified to provide or supervise the provision of specially designed instruction to meet the unique needs of children with disabilities, knowledgeable about the general education curriculum, and knowledgeable about the availability of resources of the school district. Number 4, additional group members for determining a specific learning disability, SLD, would include the child's general education teacher, or if the child does not have a general education teacher, a general education classroom teacher qualified to teach a child of his or her age, or for a child of less than school age, an individual qualified by the State Educational Agency, SEA, to teach a child of his or her age, and at least one person qualified to conduct individual diagnostic examinations of children, such as a school psychologist, a speech-language pathologist, or remedial reading teacher. And number 5, when appropriate, the child. For reevaluation, the IEP team is the qualified team, which includes: number 1, the parent; 2, general education teacher; 3, special education provider; 4, an individual who can interpret the instructional implications of evaluation results; number 5, a district representative who is qualified to provide or supervise the provision of specially designed instruction to meet the unique needs of children with disabilities, knowledgeable about the general education curriculum, and knowledgeable about the availability of resources of the school district. Number 6, at the discretion of the parent or the school district, other individuals who have knowledge or special expertise regarding the child, including related service personnel as appropriate. Number 7, whenever appropriate, the child with a disability. If the child does not have a general education teacher during the school day, a general education teacher is not a required team member. This should be noted on the ETR signature page. If related services are provided to the child or are indicated in the ETR, the related service personnel should be part of the ETR team. Any team member who is not in agreement with the team's determination of disability shall submit a statement of disagreement. Part 4. Eligibility Determination. A group of qualified professionals and the parent determine whether the child is a child with a disability. The team must verify that the determining factors for the child's poor performance is not the result of a lack of appropriate instruction in reading or math or limited English proficiency. The team has determined that the presence of the disability adversely affects the child's progress in the general education curriculum. The child must meet the eligibility criteria for the disability category under consideration, and the child must require specially designed instruction, not just accommodations, to access the general education curriculum. The team must provide a justification for the eligibility determination decision, describing how the student meets or does not meet the eligibility criteria as defined in the operating standards. This cannot be just a copy and paste from the disability category description. This is a culmination of all the components within the ETR to create a final summary describing how the student meets or does not meet the eligibility criteria as defined in OAC Rule 3301-51-01 B10 definitions and OAC Rule 3301-51-06 evaluations. The summary must also include how the disability affects the child's progress in the general education curriculum. Part 5. Signatures. This is where the team members sign the ETR. The ETR signature page must include the date of the meeting, the date of the last ETR for reevaluations, and the date of the referral for evaluation. All team members must indicate agreement with the determination or submit a statement of disagreement. The school district must provide a copy of the evaluation team report and the documentation of determination of eligibility or continued eligibility to the parents prior to the next IEP meeting, and in no case later than 14 days from the date of eligibility determination. Operating Standards 3301-51-06, capital G, 1, lowercase b.